Client education. We do this on the job every day. Every interaction we have with a client is some sort of educational process. So in dicing it up in 12 core function language, the provision of information to individuals and groups concerning alcohol and drug abuse, available services and resources. That kind of ties back to case management, knowing where available resources and services are, and we talked about that, and knowing what services you're not able to provide the client. We talked about, we had the discussion about 12-step philosophy, self-help, where we send people for certain other aspects of their treatment. And being able to present the alcohol and drug abuse information, being able to educate people about their symptomology. Oh my God, when I found out I had a disease, what an epiphany. Wow. I'm not crazy. You know, I used to hear people talk about that. When I heard about that, I realized I wasn't crazy, and it was so empowering, and I thought, God, if I could ever feel like that, that would be awesome. And it happened to me. Why? Because somebody explained to me what a disease was. And by explaining to me and educating me not about alcoholism, not about drug addiction, but what the heck a disease was, it was an epiphany. And being able to do that for our clients is extremely empowering, and it ties back to them being able to make the appropriate choices and being successful with their treatment plan, dealing with those problems and the ramifications of those problems. Present information about alcohol and drug service and resources. We talked about that. Knowing the lay of the land, knowing how to help your client and how to refer them, extremely important. And then tying right back into referral. Separate but uniquely entwined. Because you may be doing a number, while you're providing client education, you may be doing a number of different core functions. You may be assessing a couple of people in your group while you're providing client education. You may be thinking about client match and referrals as your clients talk to you and reflect back to you about the discussion you're having around the education that you're providing them. So you kind of get an idea of how these are unique and individual, but also they link up and intertwine with one another to create the treatment episode. So identifying the needs of the client that can't be met by the counselor or agency, and helping the client to utilize support systems and community resources available. Okay? So we need to know what's our scope of practice. What are we expected to do within our scope of practice? What is the expectations of our agency? Yeah, we got to know a whole lot of stuff, don't we? Because we got to be able to make the appropriate decisions, we have to have this knowledge. So scope of practice, agency scope, okay, because some agencies, they might provide medical care. Some agencies might provide therapy. Most agencies don't. And to tie back in that conversation we were having earlier, how there's more collaboration happening, there's more integration happening today than there were years ago when it was secular. Knowing how to navigate these resources for your clients and how to do it appropriately. So you're talking to John and you say, John, you know, your anger issues are such that they really are a little bit outside of my scope. While you're here with us, I want you to go see this anger management specialist. And they're over in the town, God, I can't remember the name of that town. You know where that, you know where that town is, don't you? And this guy's, John's sitting there looking at you, you know. And so even if you get through that part, and you guys kind of come together and where that town, and you know, and the person's name is, I think her name's Gail. Gail, and John's thinking anger management, male, and you want me to go see Gail and exactly. And she knows a lot about Niagara Falls. Oh, Niagara Falls. So I'm trying to make light of this, but my point is understanding the resources and, whenever possible, providing a warm handoff at a minimum. A cold handoff is just sending somebody down the street. Here's an address, and I want you to go see so-and-so. Okay? That's a cold handoff. All right? They don't know what to expect when they walk in there. All right? Now remember what they had to go through to get in your door. And you've worked really hard at breaking down those barriers. So when you provide a referral to them, be mindful that as much as information you can give them about what their experience is going to be when they get there enhances their ability to be successful and have a good experience. And if they have a good experience, it's going to build trust, continue that level of rapport that you've been working on with them, and enhance their treatment outcome. So, for instance, you know, there's this anger management specialist I've known for a number of years. They've worked with a number of our clients. They work really good on an individual basis about specific anger issues. I'm going to call that person up right now with your permission and make an appointment for you, and I want you to go and I'll set up an appointment for you, and I'd like you to go and start seeing them over the course of the next month while we're working on your treatment here. Are you okay with that? Well, I don't know. I don't know. Well, will you trust me? We'll just try it once. Okay, we'll just try it once, and then I'll check back in with you, and we'll see how it's going. You know, well, I don't know. So if a client is really having some difficulty with that, you might want to say, hey, how about if I take you on your first appointment? Okay? I'll take you over there, introduce you to the individual, introduce you to the staff. Now, in most treatment settings, that's a luxury that we don't have an opportunity to do. But we're talking about quality care here. So what's the optimum thing I can do for that client? You know, hop in the car. We're going to go run over there. I'm going to introduce you to them. We'll see if we can set up an appointment and let you feel comfortable about it. And then we'll check in after your first appointment. That is a warm handoff. Okay? Warm handoff is also picking up the phone, calling them, say, you know, and a key to this, make sure you have a release of information, okay? Because you don't want to be talking to that person, you know, I want you to go see so-and-so, and then pick up the phone and say, I got this person named John in my office, and they've got anger issues, and I want them to come and see you, because then you're not mindful of their information. You're not protecting their confidentiality, okay? So remember, the key to any referral you do, whether it's cold or warm, has to be done with a release of information from that client. You may not even be providing information to where you refer that person to, but you need to have a release in that chart to show that you gave that client that ability to have that conversation if need be. In some cases, the client may say, I don't want you talking to me. Just tell me where to go, and I'll go there. I'll take care of it myself. And then that's a different discussion you'll have with them. And more times than not, that won't happen. But if it does, don't let it hamper the situation or your ultimate goal to get that person to that referral. Like with medical services, you send a person to a dentist. What's a dentist going to do? A good case in point. What's the dentist going to do? If they've got an abscess tooth, the dentist is probably going to give them antibiotics, but what else are they going to give them? Right? But now if that client signed a release and you tell that client, look, I want you to go see this dentist, and I want you to tell them that you're in this treatment program, And I want you to sign a release of information for this. Because in a lot of instances, we know what the dentist is going to do, and if that client is not willing to do that, then they're not ready to get recovery yet. So there's lots of ins and outs how you work the referral process. And I'm sure that, you know, I'm sitting here with folks that do this stuff day in and day out. But just remember to release the information wherever possible is extremely important.